This is Dr. Sakhnini speaking, enthusiastic to show you a surgical approach for glomus tumor for the index finger. This is a straightforward surgery. We do it under digital anesthesia with a local hemostat with the help of a Penrose that we put it as a tourniquet around the base of the digit, followed by nail removal in a systematic way. And once we control the bleeding, we trim the nail in order to put it back as a bandage following the glomus removal. We used in this case a prior MRI to localize the exact location of the glomus tumor, and as such we used an ulnar incision in order to raise a flap around the base of the nail plate in order to expose better the area of the glomus tumor. Not only MRI but clinical examination prior to the surgery help with that. Once we have a full control over the nail base where we know where the glomus tumor is located, we continue by raising a flap of the nail base. This is the area of the germinal matrix. We try to open a window so that we will put it back and suture it in order to minimize any option of scarring or an aesthetic problem for the nail. We use a longitudinal incision. This will help closing back. Now we know the exact location of the glomus tumor, and we try to excise it fully. So we use here a 15 blade in order to make a fine excision of this tumor. We try to take it as a whole. So this is the tumor, and we dig around it in order to take it out from the bone, from the distal phalanx where it is stuck. So after that we take out this tumor fully, which is stuck to the digit. Sometimes it causes erosion in the digit, and take it out as one bulk. This will help alleviate the patient's symptoms. This is the glomus tumor. Put it in a gaze, examine it, send it for pathology. Following that, we diffusely irrigate the wound and use monocryl. As we mentioned, monocryl is a very good choice. It dissolves on its own, and aesthetically it gives a very good outcome. Now following this step where we close the nail bed, the germinal matrix back to its own place, we use the plate as a bandage. It also gives a very good pain control and helps keep the open the cuticle, the nail fold, in order to help the new nail plate to grow and push this bandage, the one that we put inside. So this is the surgery. This is the approach for a glomus tumor. Sometimes the tumor is more darker, more obvious clinically. Now we put it back. This is the best option, and we close the skin. As you can see here, we opened only one corner, as we already know that the location of the glomus tumor is proximally and on the ulnar part. We anchor the plate in order to help stabilize the wound. This is will help good recovery and less pain following the surgery. This surgery is straightforward with good aesthetic outcome. You can use a 15 blade or a beaver plate. All options are legitimate as long as we take the whole tumor as a bulk. I hope that you enjoyed this video with further videos to come. I thank you again and Assalamu alaikum.